With that, ladies and gentlemen, we are going to go on to the first expert session, Ask the Experts. And this session, ladies and gentlemen, is themed Nursing the Sector Back to Health, COVID and Beyond. And I'm now going to be taking you through the esteemed panel. The session will be moderated by Mr. Gautam Khanna, the CEO of PD Hinduja. He is also the head of Hinduja College of Nursing. He's on the board of 2 private hospitals and a managing committee member of a degree college in Mumbai. An experienced business leader with a rich experience of more than 30 years of successfully managing diverse business, 30 plus years of successfully managing diverse business and creating sustainable shareholder value in domestic and internationally challenging environments at Hinduja Hospital and 3M, leading culturally disparate teams across Asia Pacific, Latin America, based out of US and in India. Mr. Khanna is also an active member of various leading Indian industry associations. I'd like to now introduce the experts to all of you, ladies and gentlemen. Mr. Gautam Khanna, of course, is going to be moderating this session, but let me now take the privilege of introducing Dr. Krishna Udaya Kumar very briefly. He's already been introduced, but let's take a look at his profile very quickly. He's the founding director of the Duke Global Health Innovation Center, focused on generating deeper evidence and support for the study, scaling, and adaptation of health innovations and policy reforms globally. Now we have Mr. Narendra Varde, MD, India and Neighbouring Markets, Roche Diagnostics, India. And ladies and gentlemen, he is a competent leader with a diversified and deep knowledge of the healthcare industry. He comes armed with a total of 15 years of experience in the IVD, medical device, and pharmaceutical industries, most recently as general manager and country head at Abbott Diagnostics India. His tenure at Abbott included country leadership in diagnostics business for India and Nepal, and he also held the role of regional country manager for the Abbott point of care diagnostics business in the United Kingdom, France, and Ireland between 2017 and 2018 with a strong growth focus. Warm welcome to you. We also have with us on the panel Ms. Ruma Banerjee, Vice President, Neotia Healthcare Initiative. And ladies and gentlemen, she leads the projects and business operations with the company. She started her career with Bhagirathi Neotia Women and Child Care Center, Kolkata in the year 2001 after completion of her post-graduation in hospital management as junior executive operations. And she was quickly selected by the management to really head the administration of the flagship hospital. She was assigned with the responsibility of setting up Genome, the fertility center in the year 2006, which at present has 6 centers spread across West Bengal and Chhattisgarh. Welcome. I'd like to now introduce, ladies and gentlemen, to all of you, Mr. Vivek Kanade, Executive Director, Siemens Healthineers. Let's take a look at his profile. Now, he is ladies and gentlemen, he's handling the business of Zone India and neighboring countries, Bangladesh, Nepal, and Sri Lanka since March 2016. Before taking up this role, his last assignment was as Vice President, Global Sales and Marketing, Refurbished Business, Siemens AG, Germany. And he started his career with Hindustan Motors in 1992. During his association with Siemens for over 27 years, he's held various positions across diverse functions in sales, service management, regional management, and modality management. A warm welcome to you as well, sir. With that, I would now request the moderator of the session, Mr. Gautam Khanna, CEO PD Hinduja, to introduce the session and give the opening remarks and also moderate the session. Sir, please take it away.
Thank you, Aishwarya. And firstly, thank you to NATHEALTH for having such a wonderful panel together, and looking forward to hearing views from the panel. And as we heard from Ms. Preeta Reddy in the morning, and also saw the report from Mr. Amit Kim from IQVIA, I think it was obvious to all of us that last year was a difficult year for the healthcare sector. And that year exposed the inadequacies of the healthcare infrastructure. It also, it impacted the healthcare sector across the value chain, and with the low profitability, low occupancy, patients didn't land up, and you saw some statistics earlier. And there was a estimate earlier, there was a report done by Vicky and EY in April, which said that around 70% revenue drop would have happened in the month of April onwards, and then gradually it picked up. So that means a lot of things for people, because once you don't have revenue, everything is impacted. And what we also saw, the teleconsult, the growth of teleconsult. Now, the interesting thing is, at that point in time, we had an estimate that the teleconsult will grow by 700%. But what Amit just showed, that it will probably go back to 11% of what it was, the overall number. So I think there is something to be said in that. But so there is a lot of challenge, and we need to get this sector back to health so that we can take care of the health of the community. So I would like to have views from this esteemed panel, and what I would do is I would ask each panelist maybe a couple of questions, and then later on open it up for the questions from the audience, if that's okay. And I would like to start with Dr. Krishna Uday Kumar. So thank you, Dr. Krishna, and I know that it's all not even middle of the night; it's almost going to be early morning for you. So thank you, firstly, for coming on the panel. So now you know that hospitals across the world faced a problem, and there were no patients, and there were non-COVID patients also demanded care. So what was your experience at the Duke University, and what measures you took, and especially since you are a medical practitioner, or any suggestions for the medical practitioners? And related to that, in this pandemic, in this crisis, do you have any suggestions to the entrepreneurs in the country, in India, to drive innovation in the healthcare space? So over to you, Dr. Krishna.
Thank you for the opportunity to join you today. And you're right, if we go back just a year ago, we were dealing with this huge coming burden of the pandemic, and at the same time dealing with uncertainty. We had no idea how bad it would be. We had no idea, because the testing wasn't there, what we were really dealing with. So that lack of understanding and the lack of clarity in terms of information created enormous challenges in the early days of response. And like many other provider organizations around the world, we tried to reduce our non-COVID services as much as possible to save resources, to be safe. And that led to, of course, significant operating as well as financial challenges in the short term. In addition, we ended up having to make significant investments, both to make sure that our facilities had all of the PPE and supplies, but also that we were doing everything we could to protect our providers, our other team members, and our patients. The next part of the really crisis management became trying to problem solve in real time and innovate. So everything from ramping up our ability to provide telehealth or virtual care services many hundreds of percent beyond our current baseline, the ability to stand up our own internal COVID testing, trying to figure out new ways of preserving PPE at a time where there were challenges around the world. Um, and as we move through that, what we've come to is this intermediate term planning, where we're starting to think about, what does a post-COVID health system look like? What have we learned? There are components of virtual care or telehealth that we probably are going to continue beyond the crisis. But at the same time, we need to make plans for increasing our capacity to deal with all of the health burdens that were unmet for an entire year. And also consider that we need to move already toward population health, toward value, toward understanding principles of equity. So this crisis has allowed us as a provider organization, as with many around the world, to really rethink the way that we engage with our patients and with other key stakeholders. The flip side of that, in terms of driving innovation, has really been that this has been a cauldron for new innovation to come to the forefront. And when I think about the ecosystem in India, there's such a vibrant entrepreneurial ecosystem that already exists. And to me, the real question is now, how do you drive scale and sustainability? And there, I think, in addition to startups and traditional investment opportunities, there's a significant role for large private sector actors, whether those are established provider organizations, payers, like in the insurance market, pharmaceuticals, medical technology, diagnostics, because they can be not just a source of innovation, but really serve as scaling partners as well as integrators. So as we see health financing mature in India, as we see more of a growth in the health sector, we see really the next stage as being all about adaptation, integration, and scaling as well as now figuring out new models for different private sector organizations, as well as industries, to start working more collaboratively with the public sector. So models like public financing of private delivery of health services are ones that I think will continue to grow. So I'll leave you with that thought of really thinking about the future of how do we move from innovations that are point solutions to thinking about systems of care that align policies, financing, the competencies within our health systems, and finally integrating all of these amazing innovations that we've seen take hold over the past few months.
Can I build on to your response and ask you, see, one of the challenges is the access to capital for many of the startups to drive innovation. So any suggestions on that? How easy it would be for these people who are going to, like you said, system of care, innovate in the system of care environment. So any suggestions for that? How do they increase their access to capital?
Yeah, we've seen really struggles from the startup community over the past year as they've struggled with the pandemic. Just staying active, just being a going concern has been a challenge for many of them. In fact, part of the research we've done and just published in the Harvard Business Review in the last 2 weeks has been a study of startups and how they've responded to the COVID pandemic. And in some ways, they give us lessons learned. So the first is really to take a rapid cycle development type of approach. So fail fast, try new things, adapt very quickly. So the pace of innovation has to be accelerated significantly. The second is really building not just for the crisis, but building for the future. The third is to leverage partnerships with the public and the private sector. And there, I think, is where the investment opportunities come in. So whether it's traditional access to capital from venture funds, from private equity, from angel investors, or it's really thinking about strategic partnerships. We've started to see more in the mergers and acquisition space, as well as strategic investments from life sciences companies. So thinking about, for example, pharmaceutical companies that are trying to understand what a digital health strategy and complementary digital therapeutics may look like. Those are not traditionally places we've seen drug development and digital health happen, but we're starting to see more and more of that type of investment and strategic partnership opportunity. And of course, from provider sector, moving from just largely outpatient or traditional outpatient and OPD types of models to now thinking about how to extend into the telehealth market, how to extend into home care, as we heard about just a few minutes ago. So really is the opportunity for major strategic players to expand their domain and at the same time serve as a source of capital for startups.
Thank you, Dr. Krishna. And I'm going to leave those thoughts with Vivek and Narendra when I come to them, because you talked about the established players helping nudge the innovation a little bit. So please hold the thought. Now, can I come back to you, Ruma? And if we can hear you, what is your suggestions? I'm sorry, I can't hear you. So can you try and speak with your camera off? Just switch off your camera and speak. Let's see if that works. No, I'm sorry, I couldn't hear. I don't know. Did anybody else hear her?
No, sir.
Ruma?
So, ma'am, I suggest you try to log in from a mobile handset or any other device. Maybe the microphone of this device is not functional.
Yes. So, Ruma, sorry for doing this, but I guess maybe you'll have to log in again. And I'm going to hold your questions till I move to Narendra. Sorry about this. So you just try and log in from another device, please, if you can. So, Narendra, may I come to you? And now you saw the last year how the hospitals were impacted financially, the patient load reduced. And obviously, when the patient load reduced, the sales of the consumables and the supplies and the devices, everything reduced. So now this impacted people like you also in the ecosystem. So I wanted to know what measures you took, and again, the same question to you. What will be your suggestion to companies in the sector how to get growth back? And in this environment, what should they do? Over to you.
Thanks, Gautam. Am I audible? Perfect. Great. Thank you. First of all, thank you to NATHEALTH for giving me this opportunity to be part of this forum. I think it's a very engaging topic. Thanks, Gautam, for the question. As you rightly mentioned, we did observe significant low footfalls last year, especially in the times of from April to June. And that really impacted the business of a lot of the providers, right from the hospitals to the labs to smaller companies and companies like us as well. Because for us, our success is the success of our hospitals where they are able to deliver the quantum of care to their patients, and that was not happening. This, of course, impacted cash flows, operating margins, and the entire ecosystem had this pressure which they had to share and sustain during these times. So one of the things we did is we tried to reflect back, what can we do now? It was a new way of working, right? It was just like we've all gone digital with our conferences. The whole way of working was digital. But for our industry, it was very important that we were still providing these services in those trying times to our customers. When you look at the labs, the instruments still need to be serviced, the products still need to be provided to them. So you had to think in a very different way on how you strengthen your logistics, because the regular way in which logistics was operating, supply chain was operating, was not the case anymore. You really had to, get those passes done for your warehouses. You had to motivate people to, return to warehouses, do the packing, find alternate transport mediums where, courier services were not available. And that really was a different ask, which was very different from, the way we operate the business on a day-to-day basis. Also, when it came to our own team, our service engineers, they had to go to the hospitals. They still had to change, replace spare parts. They still had to provide the regular maintenance services. And I think it's not just the healthcare practitioners who did a fantastic job, but even, the team members really took up their commitment to the next level by really, stepping up to the ask at that point in time. With all these things, there was also a lot of opportunity because, yes, there were challenges, but there was also opportunity. With the space where we are in diagnostics, it was actually the first time where we partnered with the Indian government. We chartered, we chartered instruments to India, to different government institutions. We got them up and running within a week to support with scaling up of testing at that point in time. We helped build capacity. We also worked with all our different hospital partners to introduce new markers like IL-6, what we call the COVID panel, to really help diagnose early on, patients who are showing the symptoms. And those were revenue opportunities that, we also looked at during this point in time. At the same time, there was this whole COVID portfolio, which was there right from the antigen testing, the antibody testing, and of course the RT-PCR that we focused on bringing to the market. So I think that was one of the ways in which we kept ourselves going. When it comes to the second part of your question, I think what was the sweet spot of all of this was that for first time maybe diagnostics got its due attention. If you look at globally and even in India, the spend on diagnostics is less than 2% of the overall healthcare expenditure. The healthcare expenditure in itself in India traditionally has been quite on the lower side, and then 2% of that is very minimal. And that's where, as you rightly said, Gautam, we were scrambling at the beginning in terms of really putting that infrastructure together and, building capacity. COVID has actually helped get that focus on diagnostics. And now my wish is that, we really get it back and we really get the attention that diagnostics needs, promote preventive healthcare. We promote the fact that, diagnosing early is good for your health and should not be ignored. At the same time, a lot of the routine work which was there, like, the routine elective surgeries which were there, or, the other tests that used to happen, whether it's on cancer side, whether it was the blood banks, whether it is the different health screenings or the surveillance programs, all of them virtually came to a halt or to a very minimal percentage. I think this year, since we have kind of now understood how to deal with COVID, we really need to come with the mindset on how do we get that routine back and how do we support the communities, build more confidence in, in making them come back and take ownership of their health. And I think the best way to do this would really be, through the government supporting with the programs, with again running these programs that they have thought of, in the space of hepatitis, in the space of tuberculosis, and really, drive those further. When it comes to what guidance, Gautam, I think one of the other question you asked was to the other companies, what guidance would it be? I think we just have to innovate, right? And when you are in these tough times, I think you just have to do your out of box thinking. I think the way your team comes together, collaborates, tries to find a solution to the problem. I think that's the only way in which you can come out of this crisis and then make the most of the opportunity that we all have in the post-COVID times.
Narendra, thank you for the comments. I put you on the spot here, but I want to just ask one question related to what Dr. Krishna talked about, that big companies like you and like Vivek, I'm going to come to Vivek, so please be prepared, Vivek, that the big companies like you, how you can help the startups, maybe access capital or attain scale and so on. Any thoughts on that? Then I'll move to Vivek.
Sure. So, Gautam, the way I look at this is that when it comes to startups and smaller companies, we are actually working with a lot of them. They do position, come and present a lot of their ideas, a lot of their thoughts, and we do give them a lot of guidance in terms of how things can work, how things do not work. The one thing I think which is very important is that the startups look at things holistically and more from a longer term view, and do not cut corners at this point of time just to quickly drive scale. Because what they need to be ready to do is they need to really be able to take their niche, show the quality, show the value that they're bringing in, and also in future be ready to export and not just look at the local market. The other point I think, which may be deviating a bit from this point, is that overall I think we need to drive higher consumption, because India looks like a huge market with 1.3 billion people, but at the end we really need to drive more consumption. And when that happens, naturally it becomes very attractive for investors to also start investing more, because then the local market also also becomes stronger than just focusing on the niche. Thanks,
Gautam. Thank you. So Vivek, over to you. So now we heard the views on and the issues about last year, crisis. Now in crisis, what we see is mostly, capex is postponed by organizations, and you are primarily into, high capex related equipment and devices, and of course you have other things also. So I wanted to know what were the measures which you took and your suggestions for people who are equivalent to you in the industry, and also to the startups, what I asked Narendra just now. Over to you, Vivek.
Yeah, thanks, Gautam, and thanks, NATHEALTH, for giving me the opportunity to be on this panel. I think Narendra has already summed it up as to the difficulties faced by the industry when, let's say, the lockdown hit. I can only emphasize what Narendra said. Just as an example, we are into capex business, and when lockdown hit, there were 14 MRI systems all on their way to different sites, and all of them kind of got stranded in between. And we had the inevitable task to fill up helium into these systems, right? And though we are really healthcare workers supporting the frontline providers, unfortunately, by most authorities, we are not considered as healthcare workers. So, for example, the helium plant, which was producing liquid helium, is no longer considered as essential services, and that was closed down. and most of our people were not allowed to move. I mean, it was a Herculean effort that we had to undertake to get helium across to these 14 trucks stranded right in the middle of somewhere. Our engineers traveling along with the truck with literally no hotels open, difficulty to get food. They had to sleep in the trucks and fill helium at the sites on the roads. I think this was an absolute act of passion that I saw across industry when the lockdown hit, about how to keep the customer systems running. And I think that was the primary focus at that time, how to keep our provider systems running so that they can provide then the required patient care. The second topic on the short term when COVID hit us was how we make sure that we take care of employees and nobody loses their job. And the third one was, of course, conserve cash. While business came to an absolute standstill because we are in the capex business, everyone postponed their capex purchases. The outflow, the cost skyrocketed. As already mentioned before by Narendra, we had to charter flights to get spare parts and reagents across from United States to India, and I can tell you, the cost of the load was equal to the cost of the freight that we paid, and that was the kind of commitment that we all had to really show to keep things running. But I think as the new normal set in, we started looking at how can we really work uh, in this new normal, keeping the costs down, as well as ensuring that there is no um, let's say no deterioration of service standards that we had to deliver to customers. And I think there was a lot of adoption of technology that we saw. We gave up actually a lot of real estate space, and in fact, going forward, we have permanently adopted a hybrid work from home policy, that is 2 days work from office and 3 days work from home for everyone within Healthineers. And we have adopted ways and means and tools to ensure that we have an extremely smooth transition. So on one hand, we were looking at costs, on other hand, making sure that the customer service did not deteriorate. Um, Thankfully, over the last quarter or so, the capex business has come back. It is showing a recovery in the market, but definitely we are not out of woods yet. And looking into the future, I would say there is a strong need for innovation, and I think that is my message also to all the companies of India who are coming into this capex space. I think one important message that I mean, it's probably a little contradictory, but most companies who start out try to be cost leaders. I'm not talking about the outliers, but most companies. How can I reduce the cost of material? How can I become more efficient and reduce the overall cost? I think this has to be looked differently. We have to move on from being cost leaders to value adders. That is what I would say. Look at how we can add value rather than continuously looking at reducing costs, because uh, I have noticed that some point of time when you continuously tend to reduce cost, you will move over the line and start cutting corners. And I think that is extremely detrimental, especially in a healthcare business. So instead, let us look at how can we add value rather than cut costs. Um, I mean, cutting costs to an extent to being efficient is absolutely a must, but I think that is not the only objective. So that would be my message to most companies who are starting out there, to see how, because there is, and when you try and add value, we need to spend a lot on innovation, and I think that is where the focus should be. What can we do as Siemens Healthineers or companies like us? We are actually working effectively to incubate startups in India. Recently, I'm sure many must have heard that we have announced an investment of about 1,300 crores into a campus in Bangalore, which is for creating an innovation hub, a software development center, and manufacturing together. And when we bring all of these things together, we are also looking at actively hosting startups into this campus, and we are actually scouting. We have worked with almost now around 20 different companies within India to see what value we can add with our experience and with our infrastructure to make them scale up. And of course, the results of this would be seen not immediately, not overnight, but over a period of time. But certainly, I think the bigger companies are looking, and I can tell you, funds really are not an issue. There is a lot of funds available. There are a lot of Indian big business houses looking to invest in healthcare, and this would be an apt platform for many Indian startups to create joint ventures with these Indian houses, corporate business houses. As I said, it all comes down to the vision about how we move away from cost leadership and become value adders. So that's my message
Thank you.
to the company.
Thank you. So I see that Ruma is back online. Ruma, can you hear us?
Yeah, I can hear you all. Am I audible now?
Yes, wonderful. So you want me to repeat my question to you, but if you can tell what what measures your organizations took because you're managing hospitals, and what was your suggestion to hospitals, large and small, across the country, on how to get back to growth, and also that since you're owned by an industrial group, that
Yeah.
what are the ways of you look at increasing the investment in your hospitals, and what are the other suggestions? So maybe on the next couple of minutes, and then we will close. So Ruma, over to you.
Sure. During the COVID period, it was every day, as we are in operating hospitals and we essentially work in two significant space. One is a women and child space, and another is a multi-speciality space. Both behaved complete differently. I'll just explain how it. As a whole, on a short-term measure, as an organization, what we have started with is on the workforce protection, because it was very, very important for us to take care of the workforce, because we could understand that going forward, this we will have to utilize in multiple ways, and we'll have to protect this workforce. So it started with protecting the workforce. During the COVID period, when essentially, a lot of services were on hold, elective services were on hold, the short-term measures to resolve the problem at that point of time, what were taken were like, infrastructure management in terms of cohorting the patients in a specific floor so that the other areas we can shut down, and that'll help us in reducing the allied manpowers like housekeeping, ward boy, etc., cost of electricity, shutting down the electricity part, reduction of manpower, multitasking the manpower. As the OPD area, OPD direct physical footfall was almost nil. So we cohorted the specialties in one place so that an area was closed. Those were the major infrastructural management short-term measures which were taken. And then, of course, there was another major area which I would want to mention is the inventory management. We completely re-looked into our inventory management, the specific requirement. We identified the critical need. We identified the requirement of stock, order management, sourcing planning. So that was another major area on a short-term measure we needed to take care of. Now, going forward, as we are recovering from the COVID situation, and we are trying to come back and trying to, as we were talking about, nursing the healthcare sector, what I could feel that, what is more important along with workforce protection is a customer transparency and support. But what we'll have to do is we'll have to re-establish health system as a safe place for patients. We'll have to learn patients' preferences. in the new form of healthcare, we will have to design our operations to allow a flexible transition from to COVID situation. We'll have to sequence our return. We'll have to sequence our return in terms of starting our elective surgeries, starting our preventive healthcare checkup programs, starting our ambulatory programs with a proper scheduling and sequencing, which only can happen if we can establish a customer transparency and support system. In addition to that, what we'll have to look into is the supply chain stabilization. During the COVID period, as we were saying that we got into a specific way of inventory management, we will have to now, sitting here, we'll have to relook into our inventory management, the entire identification, reassessment of SKUs, critical demand. So that re-establishment and stabilization of supply chain is of utmost importance to my understanding.
Thank you.
Coming back, yeah.
Yeah, please go on. We have 1 minute left.
So coming back to the question which you have asked me on the investment part, as I feel that, if we can show a responsible growth pattern as a healthcare industry, I'm sure like it happened in telecom and in power sector, investments will increase, and I don't think there is any dearth of investors in this particular space. Essentially, after the COVID situation, when we have understood where we are in the healthcare, the infrastructure wise, in the manpower wise, where we are. And as an organization, if you ask me, as an organization, our investment is essentially from the holding company, as we see. So we are not into a situation where we essentially look for PE funding, etc. So
thank you, Ruma. So Ruma, thank you so much. And before I close, I just wanted to highlight key points which I took note, and wonderfully, Dr. Krishna, you talked about, and I've written it down, to focus on system of care, and enhance the pace of innovation, rapid failure and rapid success and development. And of course, you talked about leveraging the partnership with the government to see how the entrepreneurs can scale up. So thank you for your thoughts there. Narendra, you wonderfully talked about the suggestions to the entrepreneurs to look at everything holistically and for the long term. And what you talked about, innovating and collaborating. And as I say that we've been talking about it for ages, and every year we talk about it. But I think this crisis has shown us that this is reality needed, and this is the way forward. So thank you for bringing that point out. And also talking about the key point about driving higher consumption. I know this is not in the scope of this panel here, but I think that point is quite valid about increasing consumption. But let me say that as a hospital provider, increasing consumption only as needed, so not only what the patients really need. So I'm just going to leave it at that. And Vivek, wonderful story about the helium, the passion of your team and taking care of the customers, and the strong need for innovation and strong need for value addition, and your hope that there will be many JVs across the innovation ecosystem with the Indian business houses. I hope that comes through. And Ruma, lastly, I think wonderful to hear from you. And the key points I just took from there is the point you made about building the transparency and support for the patients, and also being flexible to be able to adapt to any crisis. So I think what your point is very valid. And like you said, if you have a growth plan, you will get investment. So I will leave it at that with for all the industry colleagues and all the startups. Thank you, thank you, panelists, for your wonderful comments. And thank you, NATHEALTH, for giving us this opportunity again. Thank you.
Thank you very much, Mr. Khanna, for such an insightful discussion, for leading it so beautifully. And I'd like to thank the experts of the panel as well. Thank you very much.